think one of the reasons many people are sceptical of Chinese medicine is they get hung up on the language of it all. Because we talk about things like the flow of qi, we talk about yin and yang, and these are terms which are unfamiliar to most of us in Western society. So I think it's important not to let the language get in the way. But at the end of the day, they're just words. They're words, put into a language and a context of Chinese medicine, which help us to make clinical decisions. Now, there's no shortage of research from a Western medical point of view into the effectiveness of acupuncture. The one thing we haven't been able to determine with the Western medical trials is the exact mechanism. So, how is it that acupuncture and Chinese herbal medicine is working? Well, my studies in acupuncture actually included a health science degree. So apart from all the studies we have in traditional Chinese medicine and Chinese herbal medicine and acupuncture, there are a number of other subjects included, the study of anatomy and physiology, pharmacology, all the other Western medical sciences as well. So that's then layered on top of the Chinese medicine studies, which makes you a modern acupuncturist today. Yeah, I do say it's more than acupuncture and Chinese herbal medicine. That's because I go a bit beyond what you might expect from someone who just does acupuncture or just does Chinese herbal medicine, for a couple of reasons. I see traditional Chinese medicine as a very practical therapy, and it has a long history of practitioners using what they had at hand to treat people, and particularly to suit the environment that those people were working in as well. So in the north of China, acupuncture and Chinese medicine was practiced a little bit differently to the way it was in the south, because people presented with different conditions and they had different things at hand to treat people with. So, when using it in the modern context, I think it's also important to incorporate the different circumstance under which we're living and make full use of all those therapies we have available to us now. So, as an example, I have a health science degree as a background, and part of that is studying nutrition. So why wouldn't I give some nutritional advice or even prescribe some nutritional supplements such as vitamin D? If 2,000 years ago, if hypodermics were available, would Chinese medicine practitioners been doing point injection therapy? Yep, I believe so, because they were so practical about using whatever they had at hand. Would they have used strapping tape? Yep, absolutely. If they had strapping tape available at the time, they would have used strapping tape. And you can guarantee if they had the analgesics and anti-inflammatories that we have available today, they would be using those. The important thing is to get the results that the patient's really looking for.